Acentra Health is the beneficiary and family-centered care quality improvement organization for 29 states. One of our responsibilities is to share information about Medicare that will help healthcare providers with their daily work. This video will review the important message from Medicare form from the Centers for Medicare and Medicaid Services. This form is referred to as an IM and is used for hospital and other acute facility discharge appeals. Let's go over how the form must be delivered and how to fill it out. A Medicare provider or health plan must give a completed copy of the IM to Medicare beneficiaries who are being discharged from a hospital or other acute care facility. The IM must be delivered at the time of admission and not more than 2 calendar days and at least 4 hours before discharge. Giving the notice 4 hours before discharge should be done only in rare circumstances. For example, the notice may be given at 3 p.m. on a Wednesday, with a discharge date of Thursday. The IM must be signed and dated by the Medicare beneficiary. Signing only indicates receipt of the notice, not agreement. The notice is required even if the beneficiary agrees that services should end. If the beneficiary is not competent to make decisions, the notice must be delivered to a representative. Typically, a representative would be someone who has legal responsibility to make decisions such as consent to treatment. Providers are required to have a process in place when the beneficiary is not competent and they are not able to get the representative's signature in person. The provider should call the representative on the phone to advise of the discharge date. The date of this call is the delivery date of the notice and must be no more than 2 calendar days prior to discharge. The information provided should include the name and telephone number of a contact at the hospital, the beneficiary's planned discharge date, and the date when the beneficiary's liability begins, the beneficiary's rights as a hospital patient, including the right to appeal a discharge decision. How to get a copy of a detailed notice describing why the hospital and physician believe the beneficiary is ready to be discharged. A description of the steps for filing an appeal. When, by what time date, the appeal must be filed to take advantage of the liability protections. Contact information, including any applicable name, address, telephone number, fax number, or other method of communication required in order to receive the appeal in a timely fashion. Direction to the 1-800-Medicare number for additional assistance to the representative in further explaining and filing the appeal, and the date the hospital conveys this information to the representative, whether in writing or by telephone, is the date of receipt of the notice. This information should be documented on the notice itself, in a separate entry in the beneficiary's file, or an attachment to the notice. It is the healthcare provider's responsibility to show that they made proper verbal or telephone notification. Providers must mail a copy of the completed IM to the representative on the same day as the phone call. If the representative can't be reached by phone, the notice should be sent by certified mail with return receipt requested. The date the representative signs or refuses to sign the return receipt is the date of IM delivery. Providers must place a dated copy of the notice in the beneficiary's medical file. Now, let's go step by step through the form and look at how it should be completed. On page 1, under the heading, insert your contact information here. The name, address, and telephone number of the hospital or Medicare health plan that delivers the notice must appear above the title of the form. You may insert your organization's logo, but it is not required. Under patient name, fill in the beneficiary's first and last name. Under patient number, fill in the patient number. The patient number may be a unique medical record or other provider-issued identification number. It may not be the Social Security number, health insurance claim number, known as the HIC, or any other Medicare number issued to the beneficiary, such as the Medicare Beneficiary Identifier, also known as the MBI. For Bullet 3, insert the name and the toll-free number for Acentra Health for the state in which the hospital is located. On page 2, Bullet 6 is for health plans only. The plan's name and contact information must be displayed here for the enrollee's use in case an expedited appeal is requested, or in the event an enrollee or Acentra Health needs this information. In the Optional Additional Information section, you can add additional pertinent information that may be useful to the beneficiary. It may not be used as a detailed notice of discharge, even if facts pertinent to the discharge decision are provided. On the signature line, have the beneficiary or representative sign the notice to indicate that he or she has received it and understands its contents. For the date and time, have the beneficiary or representative write the date and time that he or she signed the notice. If the document is delivered, but the beneficiary or the representative refuses to sign on the delivery date, document on the IM to indicate the date and time that the notice was delivered. To download the IM, or for more information on how to complete it, visit the Beneficiary Notices Initiative website at cms.gov/BNI. If you have questions about Acentra Health or any of the content in this video, you can find our contact information at our website. Visit acentra-QIO.com. If this video was helpful, please subscribe, click the notification bell, and you'll get notified whenever we post a new video. Thanks for watching. If you have questions about Acentra Health or resources we have available for healthcare providers, visit acentra-QIO.com/providers. The YouTube video description has useful links and additional information as well.